Welcome to Coronavirus Impact. I'm Kess Baker. Our first guest today is Secretary Cindy Dunn of the Department of Conservation and Natural Resources. Secretary, thank you for joining us today.
Thank you for having me.
So what falls under the jurisdiction of your department?
We have 121 state parks, 2.2 million acres of state forest lands, and we give grants and have technical assistance to the local communities that provide 6,000 local parks across Pennsylvania, and we fund trails.
So you have recently had an order to close certain facilities. What facilities are closed at this point in time?
Pretty much, if you can picture a state park, anything that your hands would touch would be closed. A restroom, playground, pavilions, visitor centers, and offices. Any place that we can't maintain strong 6-foot social distancing or where people's hands touch. This is to keep the public safe and to really do our share to dampen the spread of coronavirus while people are enjoying the outdoors.
And what have been the impacts of those facility closures on the state parks?
Well, it's interesting. We have had near record attendance despite that because people really are trying to get outdoors for stress, for exercise, to get close to nature at this very stressful time. And that's important to people, whether it's local parks, your neighborhoods, or your backyard, or your state park. But it's critical that people maintain safe social distancing and that people be very mindful and planful about their visit. The bathrooms aren't open, for instance, so you need to use a bathroom before you leave home. You should travel as close as possible and have a plan. If the first place you go is really crowded, don't stop there. Go somewhere else. So have a plan what that'll be. It's really critical that we maintain social distance for ourselves, our families, and our communities. And so just being very mindful of everything we've all read about dampening the spread of coronavirus.
So just to make it clear to our viewers, what exactly is open to the public right now? What can people go out and enjoy?
Well, the parks are open and the state forest land's open. I mean, the public lands of Pennsylvania are open. You can go there and walk. You can go there and spend a little time in nature, but spread out, stay away from other people and just be really mindful of everything that happens. Like if a friendly dog comes bounding up to you, don't pet it. So just you have to be super conscious of every thing you do these days, and that includes when you're in the outdoors. So the public lands are open. We are seeing a lot of visitation. A lot of local parks are open. I would encourage people to check the local park webpage before they venture out. A lot of trails are open. Again, some of this varies municipality by municipality, but our state lands are open.
And what is the importance of keeping these state lands open for people to enjoy during this outbreak?
Well, we always knew that state parks and forest lands and public lands are critically important to people. It's part of our social fabric. It's part of what sustains us, our lives. We're finding that's even more true than ever. But to do it safely, we just have to be really conscious of maintaining that social distancing and not touching surfaces.
Do you see state lands needing to close at any point in the future to help dampen the spread of coronavirus?
As with everyone right now, we're closely following our own Department of Health recommendations, and they closely monitor the Center for Disease Control. One interesting aspect of novel coronavirus is that this is new to all of us. So we're watching for science and data, and we'll be guided by the health professionals and their findings and emerging information. So stay tuned. We're meeting daily. Our DCNR team meets daily to discuss how to keep people safe in the context of allowing outdoor recreation, allowing outdoor communing with nature, but being aware of the science and the data so that any adjustments that need to be made. So just, keep in touch with us via our website or social media. We have a big social media presence describing how to do it safely. We have a lot of online resources on our webpage, from educational things people can do with their families to explore PA trails, to see where trails are, to find a local park site that shows the 6,000 local parks. All these resources are meant to help people anytime, but especially now in the coronavirus epidemic.
Now, a lot of people are staying at home or working at home. How can they make sure that they do get outside and spend a little time outside, but also make sure to do it safely?
Well, so again, if you think about your own backyard, your own porch, your own neighborhood, spring's coming. There's a lot going on outside, even in your own backyard. Migratory birds are showing up, things are starting to bloom, plants are starting to come out. Walking through your neighborhood, but again, it's great to talk to your neighbors, but keep that distance. If you choose to go to a local park or a local trail, just know probably the bathrooms are not going to be open. So just maintain that distance and be safe. But there's a lot going on outdoors right now, and people are seeking it in numbers we haven't seen before. For physical exercise, mental health, physical health, and just to get closer to nature at this stressful time.
Now, you've mentioned some advice for how people can stay safe while they're outdoors. Do you have any other advice from your department, from the Department of Health recommendations on ways that people can make sure that they are staying safe while they're outdoors around other people?
Yes, that social, so the 6 feet social distance recommendation, I'd say, is a minimum. You can get, luckily outdoors, you can often get farther than 6 feet away. Wash your hands frequently if you're not going to be somewhere. Again, as I mentioned, restrooms are closed, so bring your hand sanitizer and don't touch your face. All the recommendations that Dr. Levine goes over every day. If you do have to sneeze, even outdoors, sneeze into your elbow. Don't sneeze openly. Pack everything you're going to need for a trip and be safe at every step of the way. And that's why we're encouraging close to home. If you do decide to get out of your own yard and neighborhood, think nearby. Again, restrooms aren't open. You don't want to have to necessitate an extra stop at a grocery store for a bathroom, or you just be very planful. Whatever grocery stops you're doing now, don't add to the number of them. Just be planful, have everything you'll need for that trip, and don't touch anything, even that very friendly dog. And ask your children, as fun as it might be, to go into a playground. Don't enter any playground, whether it's a state park or a local park. Those surfaces cannot be kept clean at this time, and it's critical that people not touch those surfaces.
Now, how can people make sure that they can keep trails, open spaces, parks clean and safe for everybody to use when they come and visit?
Thank you for asking that. That's really important. Keep in mind, our staff and local park staff are not as many staff available. These natural resources are the common property of all people, and it's up to us as stewards to keep them clean and safe. So take a trash bag, take your trash out with you. We're not going to have as much ability to clean up after people. So be a good steward of these resources and take care of them, because we want, when this is over, when this is more past us, we want these parks to be ready for visitation. We want the natural attributes, the plants, everything that's there now to be safe. So take care of these places. They belong to all of us.
Now, how has the outbreak of coronavirus affected your agency specifically?
A lot of staff are on work from home. We have ranger staff, and increasingly we'll have some maintenance staff available. The ranger staff are there to keep people safe. We'll have some maintenance people on site, again, to keep people safe. As spring comes on, we have to try to spread people out by directing people to less busy areas. We'll have a lot of signage up to direct people, since not what to do and what not to do, to keep people away from surfaces like pavilions and visitor centers and bathrooms. We have a lot of people teleworking, so we're on conference calls a lot every day. We're updating our web pages and our social media, so I'd encourage people to get on our social media. We have a lot of content on social media that will help guide people's activities in the outdoors. And our educational pages have a lot of activities that we're uploading for people to do with their children. Project Learning Tree, some of our educational programs, make them available for teachers, students, and families at this time. We have materials, again, on Find Pennsylvania's trails, finding local parks. So we're keeping our website content available for people to help them through this time and to help connect with the outdoors in perhaps ways that are new. I think everyone enjoys the outdoors to some degree or another, but we're finding that people really are depending on the outdoors today at this point in time because of stress, because of needing to connect with nature and needing things to do with their family, frankly.
So for our viewers who may not know, what is your website and social media that people can find these resources on?
The website is www.dcnr.pa.gov, and our social media networks are easily findable, at DCNR. So just, search our websites for links to those networks. And again, we'll easily pop up DCNR under any of the social media like Facebook, Twitter, and Instagram.
Now, your department also deals with the conservation of natural resources. How are those efforts being affected during this time of the coronavirus?
One thing I'd really encourage people, one natural resource that we're paying a lot of attention now is our state forest. We have 2.2 million acres of forest. A lot of people don't realize this is fire season in the forest. When you think about it, the leaves aren't out on the trees yet, so the sun penetrates the forest floor, it dries out the leaves. This is our wildfire season. And we're bringing on staff to manage and take care of wildfire. We're the agency in charge of wildfire management. So we'd encourage people in the forest, do not start a fire. People have a habit of cleaning up their own property and burning brush. It's not such a good idea. Be very conscious of wildfire season. We're asking people to take care of the natural assets. Plants are coming up. Some plants are rare. Please don't trample and go places and crowd places. Don't widen trails. Again, all this has an impact on natural resources. Of course, littering is the obvious thing. Again, we're not as fully staffed, but please take your trash out with you. Don't leave it behind. And of course, please pick up after your animals, pick up after your pets. And in your case, in people's case, use the bathroom before you leave home. That's the main message there. The bathroom facilities in our parks, forests, and local parks will not be open.
And one final question. How is your agency working with Governor Wolf and the rest of the administration to support each other during this time of coronavirus?
We have a lot of communications. We have a daily briefing by PEMA to update all the information. We monitor as well Dr. Levine's daily updates, which are a great asset for everybody to really keep up with the latest data and knowledge about coronavirus. The governor has cabinet calls twice a week to keep the cabinet up to speed, numerous emails and updates to keep us all connected and in service of Pennsylvanians at this very stressful time. Public service means something really important in a critical time like this when so many people depend on state services of all types. So all the agencies are working very closely together to coordinate. We have staff that have volunteered to assist other agencies for various endeavors that are critical at this time. We have a lot of people deployed to PEMA to assist at this time, and we expect that pattern to continue as we all need to reach out and help each other to get through this crisis.
Secretary Cindy Dunn of the Department of Conservation and Natural Resources, thank you so much for your time today.
Okay, thank you for having us.
We're going to take a quick break, and we'll be back right after this.
PCN offers Pennsylvania organizations, business, and associations the opportunity to have their message telecast statewide. Fusion on PCN is a platform for you to reach out to all of Pennsylvania using our statewide cable network and online streaming. You produce the content with your message, and PCN delivers it statewide. Fusion is a partnership that helps expand your reach and meet objectives through an alliance with PCN. Go to pcntv.com/fusion for more information. Tired of unbalanced views and networks pushing their own angles? PCN brings it to you straight. We don't edit what was said to fit a point of view. We bring you the entire event. No slant, no editing, the whole story. A complete view without the angle. Watch PCN on cable and on the PCN app. Stream politics and policy on your favorite device for free.
Welcome back. Next, we're going to go to an interview with Health Secretary Dr. Rachel Levine, who talked with PCN's Larry Casper yesterday.
PA Health Secretary Rachel Levine, welcome to our program.
Thank you. It's a pleasure to be here.
Your face is familiar to our viewers for giving frequent updates on the coronavirus outbreak. How do you get ready for each day?
Well, each day is now very busy, and so I'm now seeing all of my staff and all of our work is at the Pennsylvania Emergency Management Association building. We have our command center there and our senior staff for the Department of Health working really closely with all of the staff at the Pennsylvania Emergency Management Association under the direction of Director Padfield, and then with the governor's office and often with the governor, where we're speaking about all these different issues. I get updates from my team. We have robust discussions with the governor's office about our plans and policies. And then, as you said, I have a daily press briefing that I'm able to give often, which is very exciting, with the governor.
Now, Doctor, you have a lot of information at your fingertips. What kind of data do you go out of your way to include in all your updates?
In all of our updates, we're including the total number of cases of patients with COVID-19 throughout Pennsylvania. And very importantly, we're looking at the number of new cases that we're seeing every day. Unfortunately, we are still seeing an exponential rise of new cases, and that number is almost doubling every 2 to 3 days. And so we're watching that very carefully. In addition, we look county by county to see where the spread of COVID-19 is and where there's evidence of community spread. And so all that data, as well as hospitalization data and treatment data, are issues that we review every day.
Now, you and the governor are in different locations for the updates. How often do you communicate with him?
So yes, we're in different locations, and we communicate, with the governor several times a day. So we are on the phone with the governor, with the senior staff, and then often I participate in updates to the legislature and to the cabinet. So sometimes 3, 4, or more times a day.
Now, you're talking to us from the PEMA headquarters. Do you maintain your base of operations there?
Yes. So our team at the Department of Health that is part of the command center for the response to COVID-19 is at the PEMA building. And we are working again closely with all of our colleagues at PEMA, other administration departments that are here, and then with the governor's senior staff.
And when this crisis was first presented to you, what were the immediate logistical challenges? In other words, how did you reconfigure your staff and figure out how many people you needed to make these updates happen for Pennsylvanians?
So yes, as this was developing, we put together a core team. We actually have been in incident command since the beginning of February, where we had people either virtually or then eventually here at PEMA. So that includes our staff from the Bureau of Public Health Preparedness, as well as our Bureau of Epidemiology. We have staff from our bureau in terms of our community health nurses, and so a number of different bureaus. Others are working remotely. So we continue to work on other aspects of public health, health promotion, disease prevention, the Rural Health Initiative, the medical marijuana program. So all those staff are working, but they're working remotely.
How was this responsibility presented to you, Doctor? After all, it seems it would be a massive departure from your routine.
It is, but as it was evident that COVID-19 was evident and present in Pennsylvania and could be spreading, the governor actually closed the Capitol complex. The key staff involved with this response in our command center came here to PEMA, and then others went home to work remotely. But it has been a challenge and an adjustment to move our offices and our base of operations here, but we have a very smooth operation at the present time.
When you're giving updates, Doctor, and you're standing in front of the camera by yourself, do you feel disconnected in any way?
No, not in any way. So if I didn't like public speaking, I probably picked the wrong job. And so I'm very comfortable with public speaking. In my previous position at Penn State Hershey Medical Center, I taught medical students and residents and did many types of medical presentations. So I'm very comfortable with it.
In one of your recent updates, you mentioned what you called a social media presence. So talk about how that's getting you feedback from Pennsylvanians and telling you that what you're doing is right.
Well, so our staff in our communications office, which are doing an absolutely fantastic job, monitor social media. So they monitor Facebook and Twitter and Instagram for people's and individuals' responses to our message. And, really overwhelmingly, the response has been positive, is that we're getting our message out. And the key messages that we need to get out is the importance of staying home. Right now, one of our biggest tools, as the governor was talking about in the press conference today, is keeping people home so that we can try to mitigate or prevent the spread of COVID-19 in Pennsylvania. That allows us to let our health system prepare for the potential surge of patients, and we're hoping to kind of cut off the tip of that surge, so it's not a large tidal wave, but a small rise and then a small decrease that our health system can manage. And so all of that is critically important, and that's the message that we're trying to get out. And that's why I finish all of my press conferences with stay calm, stay home, and that's the way to stay safe.
Dr. Levine, you touched on this a couple minutes ago, your experience in medicine, and I'm sure Pennsylvanians would like to know more about your experience in medicine and with infectious diseases.
Sure. So I'm trained as a pediatrician. I graduated medical school. I went to medical school at Tulane in New Orleans. I did my training in pediatrics at Mount Sinai in New York City. And then I did a fellowship in the field of adolescent medicine. I then stayed at Mount Sinai for 5 more years in pediatrics and adolescent medicine. And then started in 1993 at the Penn State College of Medicine, first at a hospital in Harrisburg, what was called Polyclinic Hospital at that time, and then full-time at the medical center since 1996. During all that time, in addition to seeing adolescents with many different issues, particularly eating disorders, I also did a lot of pediatrics, where we saw many infectious diseases, and so have been a lot of medical experience in this area. But it is very important to recognize is that we call this a novel coronavirus. Novel means new. And so no one has seen this virus before. They've seen other variations, SARS and MERS, in the last 20 years, but no one has seen COVID-19. And so, we're all learning at this time about the different biological characteristics of the virus, how people react clinically to it, and then how we should respond.
And since it is a novel or new virus, we have little or no resistance to it, right?
That is correct. Because it's a new virus, no one has the resistance or has the immune system response to this virus, which is why it poses such a very serious public health threat. This virus is more contagious than the flu and is more serious and causes more illness than the flu. And so given all of that, that's why we're seeing the global pandemic of COVID-19.
And let's consider New York City for a minute, Doctor. How closely are you watching what's happening in New York City? Of course, they're considered currently the epicenter of this crisis nationally. What can we learn from their experience?
Well, so yes, we're watching the situation in New York City very, very carefully, and our heart goes out to New York City, to patients there, and to healthcare providers on the front lines. But we are, again, taking lessons from that. It highlights the importance of early prevention and mitigation, which the governor has instituted with the closure of the schools, the closure of non-essential, non-life-sustaining businesses, and then the stay-at-home orders for the most heavily affected counties. As he recently mentioned, we're evaluating that every day to see which counties might need to have that order in the future. And so we'll be taking that day by day. We're also evaluating their health care response and the surge of patients that I have been talking about. That the concern about that surge of patients is exactly what they're seeing in New York City. And we need to make sure that, one, is we do everything we can to cut off the top of that surge, but then to be prepared for the surge of patients with our healthcare systems.
How much impact can one person have by staying home during this outbreak?
A tremendous impact. It's shown that for every person who contracts COVID-19, at least 2 people will contract it from that person. And you can see then how it spreads through a community and how it could spread through a county and then the state. And then, of course, if you are staying at home and your family is staying at home, you're protecting yourself, your family, and our community.
Last question, Doctor. Does a situation like this move in stages? If so, which stage are we in now?
Well, yes, it moves in stages. So at first, in terms of our response, we were at first seeing no cases, and then it was only now less than 3 weeks that we have started to see cases of COVID-19. And then we were doing our containment phase, where we were tracking really carefully any new cases and their contacts. We are now, as I've been saying, in the mitigation phase, trying to prevent that surge. Next, we will, over the next number of weeks, we will see an increase in terms of the number of cases, the numbers of new cases, and then numbers of patients in the hospitals, and we'll be doing everything we can to resource them. With all of our efforts, we then hope to bend the curve of the number of new cases. When we're doing that in a very sustained, continuous way, then we can start to slowly relax some of those prevention and mitigation efforts, always monitoring for any potential new surge.
PA Health Secretary Dr. Rachel Levine, thank you for your time.
Thank you very much.
And that is all the time we have for today's show. Coronavirus Impact airs on weekdays at noon and at 8 p.m. It's also available on PCN's Facebook page, YouTube channel, and on our website, pcntv.com. I'm Kes Baker. Thank you for watching.